This is Athena Jezik, and I'm here today to just kind of show you what you can do just to get a person to relax down on the table if you happen to be a therapist, or if your partner or friend or spouse or whatever is a little frantic from the day, just to have them lay down and do some of these techniques is a good way to help them relax. It's not anything real difficult, but it does really help out to get the person out of the stress mode and into the relax mode, or out of, we could say, sympathetic into parasympathetic. So I'm going to be primarily working today on the head and neck and a little tiny bit of the upper shoulders, just the part that's kind of connected to the neck. And just show you some things that you may not have thought of, and you can try and just see. And whoever's on the table with you, try to get them to not think about their day, that they're just going to lay there and watch a movie. So just like it's whatever's coming before their mind, their eyes, that they just let it flow past and let them just feel everything in their body relaxing. So to start with, I'm just going to have you put your hand underneath their head, or that's what I'm going to do. And then you can just put the other hand on top of the head here and just hold it for a while. And just hold it and just find yourself melding to their head. Don't put pressure on it. It's just that their head is resting in your hand, so that's the amount of pressure as whatever the weight of the head is in your hand. You're not pushing up and making more pressure. And in the forehead, up on the top of the forehead and all that, you're just letting it relax. And you might feel some movement happening, and that's a good thing if you are, because it means that the stress levels at a subtle area is able to let go. So all of that is really good. I know it's very hard for some people to just let go. The other thing is trying to get your mind to just turn off, because when the monkey mind gets going, it just keeps on and on and on, like the little error-ready bunny. And just feel the body beginning to relax. And so there's no thought. Sometimes you can start to see colors. Sometimes you might get visions or pictures. Sometimes you might feel like you're not really gone, but you're not really here. That's when you get to hovering over the body, what we call hovering, where you're just kind of there, you're aware of things around, but you're not really so far gone that you are just in your dream world. And also ask the person to just feel what they feel inside their body, because that way the awareness will come into the body, and there'll be a connection between their mind and relaxing in the body. So those are just little things to start out with. You don't want to necessarily do any kind of breath work with this, because then you're concentrating on the breath a little bit more. So just have it be a natural breath. And once it feels like they've maybe gotten a little heavier, their head may feel like it gets a little heavier, you can take that out. And then you can start up here at the forehead and just kind of very slowly. Everything here for relaxation is done slowly. And you just widen your thumbs and let that happen. And you go little by little. You move down with each little step. And down until you get to the eyebrows. And then you can also do some little up and down with the forehead. Just really gently. You're not really massaging it, and you're not just tickling it. It's that there is a bit of pressure to activate the muscles and relax them out. Activate the relaxation part of the muscles, and just feel it going deeper and deeper. If you see a nice deep breath happen on them, that means that they've released something in the body that was stuck. So that's a good sign. That's a really good sign to have. And then brushing around the eyes a little bit. And going back with your fingers, moving the scalp around. It's the scalp. You don't want to just rub the hair follicles. You want to feel the muscle. It's very thin muscle around around the head. So you want to let your fingers feel that kind of that rotation. And that's another very relaxing thing to do. And then as you get down here, you can begin to work the ears a little bit. What's nice is you just grab an ear. I'm doing it on both sides together. And just little circular movements to just, even the ears feel good to relax. They probably hear too much noise during the day, so it's nice to get them to calm down and do this. There's a really relaxing thing I'll show you that you can do. One is you can hang on to the edge of the ear, a little bit on the inside, and then right behind it, so like your fingers are actually meeting, but the ear is in the middle of it. And you can just make little circles there, and then you can just hold it, but you're not pinching it, you're just holding it, and then just start to pull it out away from the head, really slightly. You might feel a little rotation happening in the ear, because it's letting go of some of the tissue that's where the ear is attached. The ear is cartilage, so it's softer, but it still does have to be attached with a little bit of muscle. And just let that kind of pull out. It feels really good. You're also stretching a membrane inside of the head with this move. So you're going very deep in the body, even though it doesn't seem like you are. Everything that you're doing and everything I've done, showed you up to this point, is that you are also affecting things deeper in the body that you just aren't aware is also correcting. You can move up a little bit on the ears there and do a little bit more pulling. And then just you can rotate a little bit. You don't want to pull really hard, but you do want to make it feel like there's something being done. So now, because I've gotten more of the ear pulled, I'm just going to pull it a little bit more, a little bit farther than I did before. And that's good. Yeah, that feels real good. Okay, then you can go back up kind of around that and come back up and go across the eyebrows. And just kind of get into the nasal cavity and pull out there, and lightly, go very lightly on the sphenoid, wing of the sphenoid, which is your temple area. Just go very light through there. And then you can take your hands and set them on top of the forehead, just very lightly, not any pressure. You don't want to like even rest your hands there. You want to hold your hands and drop the fingers to where you're feeling their eyes. And just kind of feel those eyes, and you can move your hands a little bit. You don't want to push into the eyes at all. You're just resting your hands on them. And you can like rotate a little bit or feel how they want to move. But you can, once you start picking this up, you can really feel when they're relaxing. It's very obvious. It becomes very, very obvious. And then you can move a little farther down. Another thing that's comfortable for the eyes is to go underneath and just kind of, just the little skin pulled in that direction, underneath the eye, both eyes. I'm doing both eyes. And if you can do that with the fingers too. And then if you feel like you're comfortable with this, you can also very lightly get a hold of the eyeball, the eye socket. You barely hold on to it, and just kind of rotate it just slightly. You don't want to rotate too much. And that just kind of wiggles the eye around in the socket. It makes it feel good, but just don't do very much and do it so light that it doesn't cause any stress on the client. If they start jumping around, then you'll know that you're going a little bit too rough. or if you feel a sense of their nervousness, that's another reason. Just lighten up. And this is with the nasal bones. And what I'm doing here is I'm just working the nasal bones, doing little circles, and also doing a little bit of decompression with the nasal bones. And that's really comfortable too. Okay, now you can roll down into the cheekbones and just kind of work circular through the cheekbones. And just follow that up back to the ear. You can go a little bit farther down there, just little circular motions. And then you can also, from under the eye, you can take your thumbs and just very lightly pull around the eye and up. And same thing, move it down a little bit so you're taking like one little strip at a time and moving downward into the face. And you're so light here that you don't really need any oil unless they're very, very dry skin. And you don't need very much. So there's that. And then you can go down into the chin area and sweep this up. And get into the ears and go as high as you want to. Then you can take both sides of the chin and just work up the jawline. And then get closer to the lips and the same thing, just work it up. And then from the corner of the mouth, you can just pull it more upward this way. And then from like under the nose, you can pull it out that way. And then you can pull it up this way. And you can push it downward and open that up there. And then under the nose again. And then up the kind of the little triangle that's there and back down. It's easier to do with the thumbs. Back down, back into the chin, make a little bit of movement like that. And then just place your hands completely, all over the whole face. I like to tuck it behind the ear, my little finger behind the ear. And just set your hands on there. Don't push into it, just like you're just setting your hands there. And just feel, you can push your energy into there if you know how to do that. And just feel that nice, good, and relaxation happening. And then you can go a little bit down to the neck and just on the sides of the neck and just brush upward, kind of pull upward a little bit, and then push back down. Because we don't want to cause too much conflict with the lymph system. But if you're light enough, you can go upward because the lymph moves downward. But if you're light, you're not going to bother for this particular piece. And then you can just go along the shoulders there and into the clavicle area. And then you can just kind of end by putting your hands on the shoulders and very lightly, like an assessment, but you can assess it, but you can understand and know that they're relaxed. Unless they just can't turn their brain off. You can tell when they are and when they aren't. It's really gets quite easy to tell. I can always tell when people are deep, even though they might be as still can be. I can always tell if they've gone over that line of being deep or if they're still on the edge. And then my hands are just over the clavicles here, and my thumb is at the base of the neck. And just holding there and just feeling what it is. And you can kind of brush out. It's not really a deep brush. And then you can take your hands back under. And if you know how to do this technique, you can do with the occipital base release. And you don't have to do a full one. You can just hold that head and let the weight of the head, particularly where the fingers are, you want to be sure that you're at the edge of the bone, not on the bone. And I just feel a lot of releasing in this part of the muscles. It's really letting go. It's like, oh, I just have to let go. And that's when you can feel them letting go and relaxing out. You can hold that as long as you feel necessary. And then come out and then give a little more, and maybe do a little pull here from the spine outward. And then a global kind of a head work where the skin and everything is working. You're just moving that skin around, take it one direction and then do the other direction. Kind of tricky to do the different directions. I get confused which way I'm going. And then that's pretty much the way to start out, just relaxing somebody. And if it's just all they need sometimes is just a little relaxation, and they'll feel so much better, because it has been taking tense muscles from the whole body and allowing them to kind of be at peace for a while. Okay, so once you feel that they're, you've gone through all kinds of motion here, I'm just going to rest my hands like this, because it's the energy from my hands is going to go in and continue to help them relax. But I want you to understand something here that's hard for some people to get their head around, but it's a very profound thing with the body. We just worked basically on Melissa's head and face, but she got relaxed down, and when she's relaxed in this position, then the body can begin to organize itself toward healing of what it needs. Now, if you're really sick with something, that's another issue, but I'm talking about healing, getting out of the sympathetic nervous system, because staying in sympathetic nervous system will bring on other things that aren't going to be necessarily good. It can bring on some pretty serious diseases over time. So just know that getting the body into this parasympathetic position, the body will be able to reorganize itself into where it needs to be to prevent a lot of this stuff, or to just have a breather for a while. And that's a really important thing to understand. It also is going to go into the energetic bodies, which very few people think about. And some people who do work into the energy work, Reiki or off the body in some way, a lot of them don't understand the connection that has with the physical body. So you want to remember, if you're a therapist doing this, or even if you're just getting the work, you want to have somebody who understands the different layers and levels of where the healing is. And just know that one of the basic things to do is, it's with the physical body. It's with relaxing it, getting it out of that sympathetic mode where it keeps the muscles at the musculoskeletal level, keeps those tight. That just interferes with so much because you're still in a stress stage. And so it is going to affect every kind of flow in the body. It'll affect the lymph, the blood. It'll affect digestion. It'll affect a lot of things, because energetically, you're not going to be balanced. So you can just take that to heart, and, over time, it's a process. So don't feel like you have to just jump into it with 2 feet. Just be mindful of it and begin to ask your body to show you things like that. And your body will show you. Begin to think things like relaxing. Don't think stress. Don't use words that are negative, and keep talking nice to the body. And that has a power over it as well. So it's just that it keeps on going, and as time goes on, I'll probably share more of that with you. But right now, just remember how important it is to be relaxed, to feel a sense of serenity, to feel like nothing matters except for right now. You're right here. You're not thinking of the future. You're not thinking of the past. And that will be a good start to keeping your body in a good situation. So if you're interested in learning more about the subtle anatomy and about some of the energy work, you can find my course and see if that's something you wanted to go into. And with that, I want to say thank you again to Melissa and Corrina and making this all possible. And I hope you enjoyed it. So have a wonderful day, and I'll see you next time. Thank you. I want to invite you to explore my course, The Foundations of Subtle Alignment. It is going to take you beyond the work of massage therapy. It will take you into the world of the subtle anatomy. Misalignment of the subtle structures is often the root cause of chronic pain, injuries, and chronically high levels of stress hormones. In this course, you will learn about the subtle anatomy and a protocol for assessing and aligning the subtle structures.